We welcome you to our module Coagulation Defects and Other Specified Hematological Disorders, HCC 48 from MRA Tips. This module has been developed specifically for MRA reviewers as a refresher on diagnosis criteria, documentation, and coding of coagulation defects and other specified hematological disorders. At the end of this module, the learner will be able to describe hematological disorders and identify their cause. Discuss the criteria for the documentation of these disorders. Identify the ICD-10 codes that fall under coagulation defects and other specified hematological disorders. Review the example of the assessment and plan for the disorder. Identify the exceptional cases which are to be kept in mind for the coding of hematological disorders. Hematological disorders afflict millions of Americans. They can be described as the disorders of the blood and blood-forming organs. Hematological disorders are usually asymptomatic and are identified in routine blood tests. Various diseases come under the umbrella of hematological disorders. They include blood cell cancers, rare genetic disorders, anemia, conditions related to HIV, sickle cell disease, complications from chemotherapy or transfusions, thrombocytosis and thrombocytopenia. For the purpose of this module, we will discuss thrombocytosis and thrombocytopenia. Thrombocytosis is a rare chronic blood disorder that is characterized by the overproduction of platelets in the bone marrow. Platelets are the blood particles that are produced in the bone marrow. They play an important role in the formation of blood clots. When thrombocytosis doesn't include any underlying condition as a cause, it is termed essential thrombocytosis or primary thrombocytosis. The primary cause of essential thrombocytosis is unclear. However, it can be connected to mutations in the genes. Thrombocytopenia, on the other hand, occurs when the platelet count in the blood is too low. In this, there is not enough platelet production to help with the physiologic coagulation process. The major cause of thrombocytopenia is usually a separate disorder, such as leukemia or immune system deficiencies. In rare cases, side effects due to certain medications can also result in thrombocytopenia. The criteria for the diagnosis of hematological disorders should include current labs with abnormal platelet count. The ICD-10 code involved in hematological disorders include: for essential, hemorrhagic, thrombocythemia, the code is D47.3 and the HCC is 48. For other no thrombocytopenic purpura, the code is D69.2, and the HCC is 48. Immune thrombocytopenic purpura is coded as D69.3, and its HCC is 48. For other primary thrombocytopenia, the code is D69.49, HCC 48, and lastly, for unspecified thrombocytopenia, the ICD code is D69.9 and the HCC is 48. The assessment and plan should address the diagnosis as current and include two support indicators. Let's see an example of a progress note for hematological disorders. Patient name: Stephen William. Date of service: September 19, 2019. Date of birth: January 13, 1969. Assessment and plan: thrombocytopenia. Stable. No symptoms. No smoking. Monitor with labs results. Follow up in 4 months. Exception: do not code if the condition is not addressed as current and with negative labs unless the disease is controlled with treatment. We have reached the end of our short refresher course on coagulation defects and other specified hematological disorders. We gave you a short introduction to the disease, reviewed the criteria for the documentation of hematological disorders, identified the specific codes and HCC category pertaining to them, discussed the assessment and plan for the diagnosis, and finally noted the exceptional cases for the coding of hematological disorders. Thank you for joining us.